Welcome everyone to my YouTube channel. It's Lisa Johnson here, and as you know, I'm sharing my motherhood journey and bringing awareness of my daughter who has Viper syndrome. And I wanted to share of the village that Callie has behind her. Everyone's always applauding her for hitting different milestones, but I want to bring awareness that our village is so big, and it started in the hospital, as you all know. She was in the NICU for about 6 months, and one of the amazing people that we had a chance to just be interacting with and help us get her to the next level was Angela Fritz, who is a neonatal PT. And we met you early on, like what, week 2 or so, maybe even week 1.
I was thinking about that. I think it was right at about the 1 week mark that I met you guys in Cali for the first time.
Yes. So we're going to talk about physical therapy, but in the setting of the hospital. I'm always getting questions about what it was like being in the hospital and what are some of the things that we had to do to help her get to next levels. And so physical therapy is just so big for us. And we also have it in our home setting. So Angela's going to share a little bit about her background. We're going to go into some questions that we had already from all of you around PT, around milestones, but we're just going to have a conversation and just have fun and bring some awareness to NICU and neonatal PT. So Angela, I'm so happy to have you here.
Thank you so much for having me. I'm so excited to be here and chat about one of my favorite little girls, Callie.
Yes, and we have given Angela permission to talk about Callie's story. We're going to keep it general, but when it comes to Callie, we're going to go into detail about her story and you being a provider for her. So permission has been given, and we're going to just dive in because it's also so good to see your face. I should have said that.
I know.
You guys, for months when I saw Angela, it was literally just mask, and I feel like Callie just didn't get a chance to see your beautiful smile, but now I get to see your face. And so I feel like so many times when I see people and I get to see them on Zoom, I'm like, oh, yes, it's your smile.
I know COVID has been such a interesting factor in how I work for sure. And I think we'll get a little bit more into that later. But I'll start out by just telling you guys a little bit about my background and how I got to be working in the NICU at Seattle Children's. I graduated from PT school from the University of Washington. Go Huskies! I know Slice is a dog too. The program was incredible and amazing. And when I entered PT school, I thought I wanted to get into more like sports kind of therapy. I was an athlete all growing up. I played volleyball, basketball, softball. I was a gymnast. I loved movement and being active, and I had tons of injuries on my own growing up. And so my goal was sort of like, I'm going to go work with athletes and help them recover from injuries and stay active and healthy. And then randomly, my advisor in graduate school was the head of a lot of pediatric research projects. And she and I just got to talking, and I've always been really driven by research and interested in research. And she said, hey, do you want to get involved in this research project with me as a grad student? And I was like, yeah, what a great opportunity. And it just happened to be working with children with cerebral palsy. And so throughout all of grad school, I actually helped with various research projects in that area. And I got to explore a little bit more about pediatric physical therapy. And I just was like, this might be where it's at. This might be more aligned with me and what I want to do. But I've always had this little thing in the back of my head since I was a brand new student that the NICU is just such a special place, and therapy there is so different. And I was interested in that. And so I got a chance to shadow with them as a student. And I loved it. I mean, it's just working with infants it's just such a special place to be. It's such an honor to be able to hold a role with families and act as their very first healthcare provider, to act as their very first PT. And it's amazing to see how much babies grow. I mean, as a mom.
Let's chat about the NICU setting, because now being a full year of Callie being in this world and seeing PT in a home setting, NICU, I feel like it's so special. And as you mentioned, for us, we didn't know that Callie was going to have any health complications till like 2 or so weeks before she was born. So then you get thrown into the NICU. You don't know how long you're going to be there. That's always the big question. It's like, when can we go home? And it's like, well, there's some certain steps you have to take before you get home. But then you have all these different doctors coming in, and for Callie with Pfeiffer syndrome, like her craniofacial team is so large, and we didn't know that we had PT services that would be offered to us. So I think every day was so new, and you and Stella came in, and it was like, oh wow, like this is great. But for me, it was such like a breath of fresh air that I had someone there to support Callie in that way, but wasn't coming to talk about like some medical term I didn't understand. Like you were coming in to help her get to the next level. And it's like, here are some ways you can be hands on in her care. And I feel like you were the only one that came in to give me the opportunity to be bedside and feel like I can do this, like, leg cycles. And so, yeah. And like you had the little like paper where you like took time to tell us like what we were going to do. And so I had that paper and it was like, all right, I'm going to come in and today this is what we're going to do. And which was so nice. So if you could share a little bit about kind of like what a day in a life is like for you, and even just kind of like your experiences around the NICU and how you have to be so careful with emotions going, and I just think you have a really great touch of like coming in and just being so comfortable and welcoming and warming in such a setting that's hard to handle.
Yeah, I think, oh God, I could talk about this forever. I feel like the NICU is a place that nobody ever wants to be, right? I mean, that is not a place that you want to find yourself with your baby. And I'm not a mom, but I think that component of NICU therapy is it's at the center of everything we do, is recognizing the place that families are in and meeting them where they're at. And in my mind, I sort of think about when you have a baby and you're rushed to the NICU and your baby's in the isolate or in an incubator and they're hooked up to all these monitors and machines and wires. In some ways, like that experience of parenthood, of early parenthood, is taken away from you. Right. And it's given a lot of the power and a lot of the like care and control is given to the medical team. Yeah. And it's necessary for the baby's care, but I think that it's a crucial part for us to hang on to, is still centering the family around everything to do with the baby's care in the NICU. And personally, I think I have the best job in the NICU because I get to really help do that. Yes. I don't have to explain diagnoses. I don't have to deliver hard news. Instead, I get to really focus on who the baby is, what their strengths are, what the family's goals are, and really just kind of helping babies do baby things and helping parents do parent things. And I just think that it allows me to play just a very positive role in the very kind of stressful and traumatic NICU setting, which for me is just like such an important part of like my job and my career.
Yeah, and I definitely feel that. I definitely feel like when I would see you come in, it was like, yay! Like I would get a light because it was a time for me to be so hands-on. And I also feel like even when you would give me the green light to do certain activities and exercises, she was also like so small and in this setting where I was like, am I hurting her? Can I do this? So after a while, I was like, okay, now I feel confident to interact with my child in a way that I should. But you build that confidence for the parents. And I think it's so great. So I'm always curious of how you get assigned certain babies, or what's that look like for you? So like Caliyah was born and you get like a report that says, here's this child that's in the NICU, here's what she's going through, go meet the parent, or do you have certain like protocols or exercises that you would take someone through no matter what, or does it depend on the syndrome? Like I'm always curious about that.
Yeah, that's a really good question. So what happened, so my team, I'm on the infant team. So we work a lot in the NICU, but we also work in other areas of the hospital. So like when Caliyah moved to the pulmonary floor, I got to follow her there, which is another great part of my job, is that I get to be consistent with families in ways that some other providers aren't able to do. Right. And so we work in the cardiac ICU, we work on the cancer care unit, we work on the medical surgical floors, we work on the pulmonary floors. Basically, wherever there's a baby in the hospital, our team works with those babies when they have therapy needs. And so, so the infant team is about 15 of us, and there's some that are like Stella and I, we are more directed towards developmental care. And then there's other therapists that specialize more in feeding therapy and kind of like oral motor skills. So I'm a developmental therapist on the team. And so what happens is if there's a baby that has any sort of therapy needs, the team will place an order for physical therapy, and the orders just all come through to the team. And so it's actually interesting. I feel so lucky whenever I get paired with, families that I just like click with and connect with, and we just get to have like such a special relationship, like with you and Rome and Cali, because a lot of it is just kind of random. The order comes in and we sort of sort through, okay, who has space on their caseload. We also try to sort of divvy up which orders are actually in the NICU, because we are only allowed to work with those babies during care times. And so the other floors are a little more flexible. So we try to kind of manage how many babies we have in the NICU versus other floors to kind of spread out when we can see babies. Yeah. So on that day, when Callie's order came through, it was really just kind of like a matter of luck, where I said, hey, I've got space on my caseload. Stella and I went down together because we did know that Callie had some joint range of motion restrictions, right. And Stella's really good at making hand splints. And so she and I kind of teamed up together for that, and she made Callie some nice little hand splints early on. But I remember the first time I met you guys, and, range of motion is one of the things that we were, working on with Callie. And we started out with just like some really gentle, very simple bicycle kicks. We did some like hip circles and range of motion. And I remember you saying, I know how to do this. I ran track in college. Like, all right, girl, like we got this. And you just jumped in there with Callie, and we're just like doing these beautiful hip circles with her in like such a supportive and wonderful way. And it just like made my heart sing, because I was like, oh, these guys are going to be just fine. Like,
but what are some milestones and exercises that you work a lot with in the NICU setting for those who like with mobility or just in general?
Yeah, you touched on a lot of really important ones for Callie, and lots of babies have very similar needs as far as range of motion goes. Another thing that we work on a lot is teaching parents and working like as a team with the parents and the family and caregivers, whatever that family unit might look like, on how to read their baby's cues and how to respond to those cues in a way that is, safe based on their medical needs and supportive based on their emotional needs. And so we work a lot on like identifying and kind of reading infant stress cues, responding to them and soothing the babies. We really help parents feel comfortable with like handling and holding and moving their baby. Sometimes really early on, or if babies are really critically ill, a lot of what we're doing is we're just there to provide comforting touch to sometimes counteract some of the negative touch that they might be feeling while they're in the hospital and getting different procedures and heel pokes and blood pressures and things like that. So
yeah, I didn't even think about that. And I know for us, like we were in the NICU until let's say from January until April, and then we moved down to the floor. And when I think of, I'm going to share some tips that I have for parents. I'd love to hear like, your perspective and what you have. But for me, being hands-on was so key. Rome tried to make sure that we were not hovering and like being overprotective of what doctors were doing, but just like looking and like, how do you flush her G-tube, or what does this little probe mean? And what does this number on the monitor mean? And I feel like every time we asked more questions and we got closer to the bedside, we felt confident with each next stage that Callie was going to be hands-on and to care for her. And then when we got home, it just kind of translated even more of we can do this. Like we did this earlier on, and as she's gotten older, less like probes needed and less like wires needed. And so as she started to like remove some of those different machines, it was like, oh, okay, if we can handle her in this setting, we got her in this type of setting. But we had to just take everything day by day because the big question is, like I said earlier, you're wondering when you're going home, and it can just be very draining. And the NICU compared to the floor, it's so different. Um, we moved, I think we had like 5 or 6 different rooms, and sometimes it was like you come in and then I would go to that room and they're like, oh, no one told you she's actually over here. And you had to just learn how to just go with the flow. I'm such a planner, and I got in my routine. And if anything kind of moved my routine off, it really threw me off. And I had to just learn how to be a little bit more flexible. So what are some tips you have for parents who are having long stays in the NICU or even just in the hospital?
Yeah, you touch on a lot of like really important points. And I think that empowering parents to be as involved and active in their baby's cares as possible from the get-go is just a really crucial part of making sure that families are being like centered along their baby's journey in the NICU. And we know from the research that the more involved parents are, the better off the babies are. And we try, from a therapy perspective, one of our first goals is let's do skin to skin care. Let's put that baby on your chest. Let's figure out how you can hold them, because we know that connection and that attachment and that bonding early on is just, it's so crucial for babies and for families. And I think it's so important for that resilience piece of being able to weather a long NICU stay, because it's hard in so many ways. And the NICU is a very interesting place too, like you mentioned, the window and the light, because the NICU is a very protective place, right? So it's supposed to be quiet, it's supposed to be dark, it's supposed to be a very like low stimulation and very healing setting, which we know is important for those healing babies. And we also know is really hard for the parents who are also in those hospital rooms all day with the babies. So I think it's important to take breaks, to go outside, to go to Starbucks and get a coffee, to have some time away from the bedside so that you can still take care of your own mental health and your own emotional needs, so that you can best be there for your baby. And I think another thing, this actually a family said to me in a care conference last week that just touched my heart, and I just thought it was such a beautiful way to sort of think about it, is he was saying for the first few weeks, they've also had like a several month long NICU stay that's been ongoing. And they said for the first few weeks, it was just like, okay, when are we going home? How are we getting home? How long till we get home? And eventually they shifted their perspective to say, you know what? Home is where our baby is safe.
Oh.
Home is safety. And so at this point in time, home is the NICU. And I just thought, wow, I think that's a hard thing to do, because the NICU does not feel like home. And I had another parent say something to me one time that I thought was also very mind opening. She said, the way the dynamic works is we are living in your workplace and you are working in our living room. Oh. And I was like, oh my God, that is so true.
Yes. Yes.
And so that dynamic, between this is your baby and this is your family and this is your life, but also it is like our job and the medical team's job to take care of your baby. It can be a tricky space to be in. And so I think advocating for your needs, advocating for your baby, taking care of yourself, and just being as active as possible in your baby's cares are just some strategies that I've seen families use during their NICU stays that seem to be successful.
Yeah, you hit on a lot of good points. And I feel like earlier on, it was such a struggle where, like you mentioned, the nurses and the staff knew my daughter better than I did. and they had better skills to care. And then over time, I had to kind of shift my mindset and like, that's how it's supposed to be right now. It won't be like that
Mhm.
forever. But the more I ask questions, the more I get involved, the more the power dynamic shifts a little bit more. Because I remember one day I came in and the nurse had this like heavier like pillow, like the weighted pillow on
The Freddy
Callie.
Frog.
Yeah, yeah.
Yeah.
And she said Callie really likes this. She really likes this like weighted, and it was a nice gesture, but to me it was kind of like, oh, like she was
You're
telling me
telling me what my baby likes.
yeah. And I was
Yeah.
like, I had to stop. I'm like, she's not meaning it in any type of way, but that stung. I was like, call once the pandemic hit, how much things changed. And Callie had just recently had a surgery that she didn't respond too well with, and she had a bad reaction to it. She was very swollen, and she was just starting to calm down from it. And we're like, okay, like we feel good to have family come back in and see her, and that was going to be our part of us taking a break. Rome's mom's gonna come in and hold her. So we were like, we feel good. And then I think she was able to do it one time, and then we got the note of, we're not having an
No more
outside visitors.
caregivers.
Yeah, no more caregivers. Only two people can be on the list, and only one person can come in at a time. The wearing your mask from all the doctors. So not only are you taking the setting that is also like a little harsh, a little bit
Mm-hmm.
just stressful, but then you're putting the mask on, and you can't see anyone's like smile, and you like having it really close. Like, what did you just say? Like, I can't understand
Mm-hmm.
you. And I know as we're the parents, that was hard because me and Rome had to make some decisions of when it came to surgery day, who should go. And it's
Mm-hmm.
like I really wanted to go, he really wanted to go, and I couldn't explain or give a reason why I deserved to go more than he did. Like there was none. We just had to just choose. And so sometimes I just say you should go, and we just had to have those moments. And that was tough. That was tough, and we
I
were
think
just
that has been the number one hardest thing about the pandemic. I mean, the masks are hard, the protocols are hard, but the limited restrictions have been the hardest. And for so long, it was like that, where you could only have one caregiver at bedside. And I
yeah,
just think like having a baby in the hospital is hard enough to begin with. And then you can't have your partner there. You can't have your mom there. You can't have anybody else there to help support, to
right,
help learn cares, to help work through this, to help sit with your baby while you run and grab a coffee.
right.
And that has just been the hardest. And so, for me, like I have just been like so overjoyed with the way that our state has been handling the pandemic recently, how we've been able to control the curve, flatten the curve, how things are starting to get a little better. I have my vaccine and fully vaccinated, and that's
Yay.
happening more widespread. And so we actually were able to lift that restriction recently so that both caregivers could be at bedside. And
Great.
that's just been huge for babies and for families, and just for that connection piece that you talked about, that's so important. And I think another thing that I think about bonding and how that can be different and how that can be hard when your baby is in the hospital is that there are so many little creative things that we can do to help facilitate that bond. So some of the things that we do early on in the NICU is if babies, for example, are not able to breastfeed or feed by mouth, we'll still have the moms, if they are able to pump, soak a little piece of gauze in breast milk and place it by the baby's head so that they can still smell the pheromones and get all of that benefit that we know comes from just smelling and being around your mom's breast milk. And sometimes parents will leave a little blanket that they've slept with so that the babies can have that in their crib and they can feel that when they do go home to sleep. We are all well versed in Zoom now, so it's so easy now. Everybody knows how to do these little Zoom visits to have parents bedside. And the most beautiful thing is that babies know. They know who their parents are. It doesn't matter how small they are. It doesn't matter how sick they are. You can see. One of the things that I've been able to learn and to observe over the years of working in the NICU is being able to pick up on subtle cues with babies and being able to show parents, look, do you see your baby, how their eyes are lighting up when you come near? Do you see your baby, even though they might not be able to turn their head towards you? Do you see their face brighten? Do you see their body movement still and settle when they hear your voice? And just being able to share that with families, and that the babies know. I mean, they know the difference between the nurse and their mom. They know the difference between the doctor and their dad. They know when their family is near. And so we get to really like find these creative ways to help facilitate that bond and continue that relationship, even in the midst of, you know, medical procedures and surgeries and monitors and all of that. Throwing challenges our way, there's always ways for us to facilitate that connection and bond.
Yeah, that's beautiful. And I feel like, you know, once as a parent you see that, you see your child like light up when they see you, or like you said, might not be able to turn their head, but they stop, and you can tell that they feel your energy. It hits you like, okay, like we have that bond, and the confidence just builds from there. But as far as like with the pandemic, has anything changed in your sessions of how you've been able to work with your kids?
It's kind of shifted a little bit over the year that we've been doing this now. So when the pandemic first hit, we really did try to shift things. So we tried to limit therapy to basically just like, you know, really critical needs for splinting, for feeding, for, you know, positioning needs, which was really hard because so much of the benefit that you get from therapy is from that continuity and from having these, you know, frequent sessions throughout the week to help babies slowly make progress. We did a lot of telehealth visits early on where we would use the iPad to interface. If babies have, even still now, if babies have a known exposure, we are not able to work with them in the room until they have a negative COVID test. So therapies are not going into the special isolation unit unless there is like a really, really critical need. And even if we are, there's a lot of strict protocols that go under that. So right now, our baseline is everywhere in the hospital, mask and shield. And then if there are any concerns about a COVID exposure, it's the capper, which is kind of, it looks like a spacesuit with like a full like air pressure filtering system, gown and everything. And we do that, you know, there are some benefits to that because it does look like a spacesuit, but you can see your face because the shield covers your whole face. And so one of the things that I feel like that hurts my heart as a pediatric PT is the lack of facial expressions. Like you mentioned, like you and I haven't been able to see each other's faces in so long because mask. And babies too are growing up with not seeing smiles, not getting to see those facial expressions. But over this year, one thing that I've noticed is I feel like babies are starting to pick up. I think babies are so good at picking up on energy to begin with that it's very important for us to protect that with them. And so throughout the pandemic, especially, my anxiety has been higher. You know, it's just things feel a little bit unsettled for lots of reasons, personally, professionally. And so one routine that I've had is every time I scrub into the NICU, I just take that 30 seconds as I'm, you know, scrubbing my hands and forearms, and I really just center myself and remind myself of why I'm here and what I'm doing here, to put that energy in a place that is deserving of this baby, that is deserving of this family, and just recognizing that anytime I walk into a baby's room, I'm walking into the center of somebody's world, and my energy and my vibes around me need to be aligned with that, because the babies pick up on that. They might not be able to see our smiles, but they certainly pick up on our energy. So
they do. And I feel like right when we were getting ready to go home, our social worker was telling us about, you know, wanting to make sure we felt confident in her cares and we felt like we had everything we needed to be successful at home. And saying that first week of home was so key. Like, don't fake it, but somewhat, because like, you know, if you feel overly stressed or you're just really nervous and scared, Callie's going to pick up on that. And
Mm-hmm.
she's just moving from a new setting. She's coming from the hospital to home. And the home is supposed to be this loving and warm feeling. But if the two people she's so really connected to, your husband, and you, Felicia, if she feels like odd energy, she's going to pick up on that and turn it into a stressful environment. And so we try to like overly do it of like creating this warm environment for her. But as you're saying, like even just in the hospital setting, they feel that energy from everyone who's coming into the room and knowing like this person feels off or this is like bad news. Like you could just
Mm-hmm.
tell. But I also feel like she's like been she is babies adapt so well. So even
Yes,
though
they do.
like all of our nurses have masks on, she can just see it in their eyes or certain activities they do. Like she's smiling and laughing.
Oh yeah.
Yeah, she's always trying to grab the mask and like take it off, take it
Pull it
off.
down.
Yeah, yeah. And the times that we have to go to the hospital and I have to wear a mask, she's like looking at me, her eyebrows go up, like, what's going on? And then she tries to take mine off. And I'm like, she's so smart. She's like, okay, they wear masks, but you and daddy don't. Like, why do you have it on? So she has been just soaking up all of that. And she's like, no, take that off. But FaceTime, when she sees other babies on FaceTime, she just lights up. And I'm like, we got to have some play dates soon. I'm looking forward to getting back to just some bit of normalcy where we could have times for her to interact with other kids because I think that's so like key for her. And
Yeah, and it's one thing that I think of when you say that is right before the pandemic hit, I was on a really awesome committee. We were working on building a play group in the hospital on the pulmonary unit for babies who were trach vent dependent. And we were gonna have this play group where we were gonna have circle time. We were gonna do it in the family room, and parents would get to meet other parents, and babies would get to meet other babies. We had this whole program just ready to go, flyers ready, and the pandemic hit. And so who knows now when we'll be able to do this. But that is something that I've been really passionate about, especially, as you know, if your baby is trach vent dependent, your stay is just automatically lengthened because you have to get certain amounts of training, you have to secure home nursing, there's just all these pieces. And so what an opportunity to use that to help babies facilitate social interactions and help families connect and just bring some of that normalcy to the hospital setting. So I am hopeful that someday we'll be able to get back to that and have that little play group because I think it would just be such a wonderful component.
Yeah, because I think it's so good for kids who have trach, who have G2 or vent, to see other kids that look like them and just feel that comfort and like, oh, okay, because I do feel like we've gone for walks and, sometimes we have to stop a handful of times to give her a suction and we're with another family who's got a kid the same age. And after the walk, they'll be like, wow, like I didn't realize how much that took just to go outside the house or all the equipment you needed. And it's in a very nice way, but I'm just wondering sometimes how great that would be to be with another family who like can really understand and the expectations are really need to be explained because you both know what you're going through, but also like to be able to have that time to talk to other parents and to build that support system. Because I've been leaning on like Facebook groups and other kiddos who have 5% in the area and social media, but to have that in a hospital would be so amazing.
Yeah, and I think what you're doing, Felicia, is so helpful for families. I just can't tell you. I mean, I've even had families in the hospital with babies who have trach vents who know you and they know your blog and they know Caliyah. And it's so beautiful to see this community that you've created and the awareness that you're bringing to not just Pfeiffer syndrome, but to all sorts of different needs that babies have because, life is different for everybody. There's not one way to do it. There's not a normal way to do it. And I think the more people have exposure to that, are comfortable with that, are familiar with that, the more inclusive and accessible this world will be for everybody.
Oh, thank you. I wanted to get into your new Instagram because there was a few questions I had about how to do tummy time for kids who have a G2 or with a trach. And because we can't like show the examples here, your new Instagram BBPT is amazing, and it has some great examples and visuals that will be great for families out there who have those like actual questions and want to see practical ways to do certain exercises. So I want you to share a little about that, because people, I will drop it in the description below for those to kind of click on the link and go to it. But I mean, you've launched it just a week now, and I've already, it's been really cool to see the behind the scenes, like you putting together a wedge and what all goes into it, and also just the exercises, because I know that there are kids out there who have medical needs like Callie, but some don't. And they're just a little bit maybe delayed in the sense of walking or in the sense of crawling. And I think there's a lot of exercises you can do for that. And I think that sometimes you get stuck on like, oh, if my child's not hitting this milestone by what it says on Google, 6 months, what's going on? And there's a lot of ways parents can be more involved and do some exercise that you're showing to help them.
Yeah, well, that's something that I've been kind of thinking about for a long time. I really love to write. And I've had like parents say before, like, well, you should have a blog. You should have a blog. Show us how to do this, like spread this so other parents can see. And I just, it took me a while to get it up and running, but I actually just did last week. So my first two blog posts are, the first one is about what pediatric PT looks like, what neonatal PT looks like, and the different settings of that, why babies might need PT and how it might help. And then the second one was actually on milestones and the ways that we can think about milestone achievement based on individual babies' needs and what their own trajectory is looking like. So my hope for BDPT is to be able to be a place that gives practical tips and advice for parents and families, that brings awareness to different ways of life. I plan to do, tips for G-tubes, tips for trachs, talk about different diagnoses, side effects of cancer treatment, what it's like to be in the hospital, just like all these different areas of pediatric PT that I've been exposed to, so that it can hopefully be a space for every parent, no matter what journey their child is going on. So like I said, it's brand new and it's still evolving, but I'm really excited to hopefully be able to share some things that can be helpful for other families and babies out there.
Oh, yes. Well, thank you. Let's go back to that. Thank you for being here. Thank you all for watching and just tuning in to hear a little bit about PT from the pediatric side in the hospital setting. I plan on doing more of this series. We'll have next someone come in and talk about like home health PT and what that looks like in your home setting in our Birth to 3 program. So please continue to check in, like, subscribe. If there's any other questions you have, drop them down below. And don't forget to go and follow Baby PT. And Angela, thank you so much for being here.
Thank you so much for having me, Felicia. It was so good to see you. And I'll see Cali soon on Zoom, hopefully. But I know she's napping right now. So give her a hug for me when she wakes up.
Oh, thank you.